Today we are going to talk about kidney and kidney diseases in India, which is very prevalent. One has to understand what is the normal anatomy and physiology of the kidney. Every human being under normal circumstances has two kidneys, each one lying in the loin, which is of bean shaped, of the size of 10 to 10.5 centimeter in length, 4.5 centimeter in width, and about 2.5 to 3 centimeter in breadth. Each kidney has a very selective function of throwing out metabolic waste products which are produced in the body, throw out extra water, maintaining the sodium, potassium and electrolyte balance in the body. It maintains the calcium and phosphorus metabolism also. It maintains the hemoglobin level by excreting the hormone called as erythropoietin. This is the very important functions of the kidney. Even the kidney has a very vital role in maintaining the blood pressure of the body. 60% of the Indian population who ends up with the kidney failure is mainly because of the hypertension and the diabetes. There are other causes of kidney failure like chronic glomerulonephritis, infection in the kidney called as pyelonephritis, hereditary disease like polycystic kidney, congenital disease like posterior urethral valve or neurogenic bladder leading to renal failure, calculus disease, stones in the kidney leads to renal failure. These are the different other modes how the kidney fails. Other reasons are drugs, nephrotoxic drugs taken can fail the kidney. Now, as far as the treatment is concerned of a kidney failure, there are two types of treatment for kidney failure. Either patient has to undergo a regular dialysis or to go for the kidney transplant. Now, whenever the patient's creatinine rises, there are multiple stages of kidney failure, stage 1 to stage 5. Usually stage 1 and stage 2 patient may not have any symptoms, and that's why it is necessary to do the blood test to find out where they stand. As the disease progresses, the patient starts becoming symptomatic. Slowly the patient starts feeling weak, tired, fatigue. They start developing swelling in the legs, nausea, vomiting, itching, no appetite. All these symptoms gradually go on increasing. Patient starts losing weight. At certain stage, doctor has to decide to intervene and tell the patient to come for the dialysis. Now, dialysis are of two types: hemodialysis, peritoneal dialysis. For hemodialysis, patient needs a vascular access for the dialysis. That is, if suppose patient comes as an emergency and as there is no time to wait, then patient has to go for a neckline called as either temporary double lumen jugular catheter or a subclavian catheter or pump cath insertion to begin the dialysis. Once the patient stabilizes, then permanent solution is to make a AV fistula in the hand. Once the AV fistula is made, it is usually takes 4 to 6 weeks for the fistula to be matured, which can be used afterwards. Until that time, the patient has to remain on a dialysis with the catheter. Catheter has to be treated or used very nicely, promptly and aseptically. This will be the source of infection, and sometimes if the catheter is not used hygienically may lead to sepsis, infection, fever. As the catheter reaches up to the superior vena cava or right atrium, it may sometimes causes bacterial endocarditis also. So catheter has to be used, managed and maintained very well. Dialysis is to be done once the patient is on dialysis at least 3 times a week. That is usually an ideal frequency for each patient to remain on a dialysis. Every alternate day. Usually here in India we give dialysis for 4 hours, and depending on the requirement, the ultrafiltration means how much weight loss and what other changes in the dialysis to be done will be decided by the nephrologist. Dialysis, once it is started, patient has to presume that now this kidneys may not recover, and patient has to be prepared to go for the kidney transplant. Life quality is always better with a kidney transplant than on dialysis. With the transplant you are not hospital dependent, with the dialysis you are hospital dependent. You have to come 3 times a week to the dialysis unit, and there are minor, major complications or reactions during dialysis which may come. Once the transplant is done, lot of liberties you start getting in food, in liquid intake, in traveling. Everything is possible once the transplant is done. Whereas with the dialysis you are stuck to a dialysis unit. If suppose you want to travel somewhere, you first have to organize your dialysis. Okay, where and how are you going to do the dialysis, wherever you are going. In the dialysis, when the patient is there, he has a lot of diet restriction which will remain, the liquid restrictions which will remain. He should avoid fruits, fruit juices. If suppose he is getting adequate dialysis, we can give little extra proteins, there will be no issue. But if the dialysis is not done adequately, then protein restrictions also will remain. Maintaining the calories, proteins and carbohydrate properly will maintain the health of the patient. You always will have to check for a calcium and phosphorus level, and depending on that level the medical treatment has to be given. Parathyroid level also has to be checked regularly to rule out hyperparathyroidism, secondary, tertiary. In some cases patient do need surgery for the parathyroid gland. Transplant is an easy way. If suppose there is a family donor who is willing to give kidney, then it is a better way of life. Once the transplant is done, patient has to understand that he has to take medications lifelong. He has to take certain precautions because he will be on immunosuppressed and he will be prone for infection. So he should avoid crowds, he should avoid eating outside food, and he should live a hygienic life. Transplant, the quality of life will be much superior and much better than what the patient will be on a dialysis. I always would prefer patient to go for the transplant rather than remaining on a dialysis if it is possible. If suppose there is no family donor available for the kidney, patient should register for the cadaver transplant. Cadaver transplant also is quite popular and in thing now, and patient has to wait after registering, and whenever his turn comes he will get the kidney, and that also usually works well. The dialysis, what we talked about was the hemodialysis. There is another way of dialysis, is peritoneal dialysis. We call it as a CAPD, continuous ambulatory peritoneal dialysis, which again is very popular in a people who are not staying in a city or nearby dialysis units. This can be done at home, does not require any sophisticated machines, do not require expertise person, can be managed by the family member only, and this is the easy way. And CAPD in a patient whose heart condition is very poor, whose blood pressure is very low, who do not have a dialysis access, CAPD is a very good options for them. I would like patient to remain on a CAPD if they are staying in far-flung areas. Diet restriction always remains in all these patients. Salt restrictions, fruit restrictions, protein restrictions, fluid restrictions, all this if the patient takes care will have a long way. Positive thinking and positive approach to the disease will give a long life to the patient. Even though kidney disease has a difficult treatment, but if patient wants and thinks positive, will give a long, easy, comfortable life to him. Thank you.